Hi, I'm Dr. Heimlich DC, and today we're going to talk about the #1 killer in the U.S. Perhaps there is a more effective way, a less expensive way to screen for this thing, which is heart disease. Let's look closely at things called triglycerides and their relationship to the high-density lipoprotein, or HDLs, and LDLs, and cholesterol. William Castilli, director of the Farmington Heart Study, stated that serum triglycerides above 150 with the HDLs below 40 was a pattern indicating high risk for heart disease and stroke. Dr. Harry Eichner came up to the same conclusion with him and his colleagues. They spent over 10 years accumulating data on over 10,000 patients using very sophisticated collection of tests. Now, the patients who had high triglycerides with low HDLs, they were tracked, and the final analysis was that many of those patients ultimately ended up having or suffering with arteriosclerosis, leading to heart disease and or stroke. So what are elevated triglycerides, and when should you take action? Well, first let's thank Dr. Harry Eichner for his work in this and his comments on this discussion of the topic. Here's his recommendations. When triglycerides are 60% or more of your total cholesterol, or LDL, levels are increased above 120, especially if the HDL levels are below 40, further testing should be ordered. And to assess, the cholesterol particle size and density. These usually aren't done, but if you have that, you should do it. So where do triglycerides come from anyway, and how can you lower them? Well, triglycerides are produced predominantly from dietary carbohydrates, not fats. Okay? That's why a low-fat diet usually doesn't significantly lower those triglycerides. A high-carbohydrate diet causes triglycerides to rise. So from a dietary standpoint, you got to remove those fast-acting sugars to reduce the overall carbohydrate load. Okay, and here's an interesting clinical trial conducted by Dr. David Brownstein. Dr. Brownstein chose 20 non-compliant patients, 14 women, 6 men. They are instructed not to change their dietary habits, not to change eating habits, don't change their exercise, don't change their drinking habits for 30 days. They're given a minimal amount of supplementation to take. The initial post-study triglyceride average was, or pre-study, was 262. So before they had 262. Post-study, 30 days later, they averaged 192. That's a little over 26% reduction. And here's the important part. These guys were on things, not products of Big Pharma. These were nutritional products that don't have the same nasty side effects as some of the medication has. A lot of stuff prescribed for patients with cardiovascular risk can cause some pretty good damage. Now here's the thing, triglycerides, a lot of doctors really don't pay attention to them too much, at least the way they should. Cholesterol takes the main stage for the cardiovascular disease model. Now I'm going to be dispelling some of the cholesterol myths, if you will, in a future post. It's a good idea for you to pull out one of your last blood tests, okay, and check and see what the numbers are. Unfortunately, not all doctors keep up with this type of information or utilize the power of natural supplementation. They rather use pharmaceuticals. And yes, I know you think that my blood test must be okay. The nurse or the doctor said, all my labs were fine. At least one patient a week who comes in and tells me the same thing. Hey, I was told everything's okay. So on further review, when we take a look at them, they're out of range. Some of them are even out of the, not just functional range, but they're out of their lab ranges. And they're told, well, it's not far enough out for us to do anything. Well, what we want to do is look at you functionally. Let's check and kind of nip this thing in the bud. I mean, if it's out of functional range, you have a problem already. You may not have all the issues and symptoms, but you got a problem. So we got to catch that stuff early to prevent things from happening later on the line. So you need to make sure you find a healthcare provider that looks for those things, that looks for the patterns and the different type of things that can be going on functionally with your body. Look at the functional lab values, which are much narrower than the wide lab ranges like we've talked about before. So, you know, of course, it goes without saying, these people in the study too, I would recommend that they change their lifestyle. But even without changing the lifestyle, they're able to make these changes. I just thought it was a pretty neat study. I just wanted to share it with you guys out there, that you're able to achieve some pretty amazing things just with some proper minimal amount of supplementation. It's pretty powerful stuff. I know we folks just like on triglycerides right now, on the heart disease, which is the #1 killer, but insulin dysregulation, blood sugar, metabolic syndromes, those also play a key role in the cardiovascular puzzle, so don't discount those either. We'll be talking about those in a later post. So if you'd like to become a patient, you want to get checked out in maybe a different way, in a functional model way, give us a call at 480-991-9355. I'm Dr. Chris Heimlich.